Island. So Dan, how are you doing? Good to see you.
Good afternoon, Howard. Doing really great. Thanks for having me on today. And you're right, we tried to fit 900 people behind me here, but it was we couldn't distance. But thanks for having me on. And I know I'll be speaking for 900 very grateful people for this wonderful award the Chamber of Commerce is given to us.
Well, I appreciate you taking the time, and I know UMC is a big part of our community. Everybody knows somebody that works there, and we all know how hard everybody's been working. Just let's start at the beginning of this pandemic and talk about what the impact was on UMMC and how your staff responded.
Well, I think it's not an understatement to say that 2020 COVID changed our world, both across the globe, but also locally in Batavia. And the beginning of COVID, which the first cases entered our region just a year ago now, and I looked up. March 23rd was our first admission to the hospital of COVID, and really that the days and week prior to that, we were doing a lot of prep based on what we had heard coming out of the rest of the state and the country, and really got our team geared up for how to handle this new disease that we didn't know a lot about. And what I saw throughout the organization was a team of people who were eager to jump in and respond, to do everything they could to protect our patients, their coworkers, and our community, and willing to make a difference. I think we were all hearing very closely that this was going to be a game changer. This was going to be different than anything we'd ever experienced, and probably anything we'd ever imagined in all our pre-planning. But we took the pandemic books off the shelf that we've been working on for years. We tweaked them, and we started learning from the information coming out. And our organization geared up quickly and was ready to answer the call.
And we've talked throughout the year, and I've certainly and I've been out to covering some of the things going on, as especially early on, setting up the tents, and and there are also the meals donations going on in the community. As we mentioned, we can't get 900 people on camera and individually recognize anybody, but to help illustrate this, you've supplied us with some pictures, and we're going to go through those and use those to kind of talk about the year and how your staff responded to this unusual circumstance. So let me get this up on the screen right now.
Thanks, Howard.
Okay, can you still hear me okay?
I can.
Okay, so we got the first picture up, as we discussed earlier, and just so the audience knows, we've gone through these, and we're going to try to, he can't see what I can see, so we'll talk through what we have up. But we're starting off at the reception desk in your new entrance down there off North and Summit. So just tell us what we have going on.
Absolutely. So one of the first things that we did as we geared up to respond to COVID was ensure that we were going to continue to be able to protect our patients and the staff in the hospital. And what we were learning was we needed to really be sure everybody entering the hospital was symptom-free. And the Department of Health and CDC were providing lists of symptoms, and so what you're seeing here is the first establishment of our door gateways that were put in place at our main facilities, both at North Street and Main Street, and we were making sure that those were able to help make sure we didn't let anybody in the facility that wasn't needed or had an illness of any kind that maybe shouldn't be in there.
So we talked about some of the cleaning and PPP issues, and that I'm bringing up those pictures now.
Absolutely. So new recommendations were coming out right away at the beginning of this of new personal protective equipment that we as healthcare providers and eventually our community really had to begin implementing along the way. So some of these pictures illustrate our providers and our staff donning masks full time, donning face shields and other equipment that they needed to wear all the time. Prior to COVID, we would wear masks in certain environments and certain settings, and this was quickly becoming a global need to wear these continuously and really changed the complexion of the work our team did. And So they, really, as you can see in some of the photos, our team stepped up. They put them on. And the great news is early on, PPE became difficult to obtain around the world. And we are very grateful to our community partners for stepping up and many times giving donations of PPE to help see us through until our stocks arrived. Genesee County Department of Health was phenomenal in helping us ensure that we had a continual supply of PPE. And then eventually, as the pandemic wore on, we did secure our proper 90-day supply that we maintain today to make sure we're never running short on it again. And then we moved right into the cleaning. Really, as we're learning more about the disease and how it lived and how it didn't live on some surfaces, our team, really looked at different ways to implement cleaning, wiping things down more frequently, and making sure that we were protecting those folks that had to come use our facilities.
Early on, one of the went out and took some pictures, and we talked about this early on. You set up the tents. Tell us about that process, and how your staff responded, and then how you evolved out of that and why.
Absolutely. So one of the things we were hearing that was on the horizon was a potential surge of patients that could overwhelm our emergency rooms and our hospitals. And learning from the experiences that were being had around the country, we knew that patients, some could have a version of COVID or have COVID and go home and recover just as well, but they needed to know that they had COVID so they could isolate, and they needed to know so the doctors could guide them on the right treatment regimens that they needed. And so the tents quickly became a form for us to do that, keeping patients from coming into the hospitals that did not need to be there, but providing a comprehensive medical evaluation, diagnosis of COVID, and then getting them back to their houses where patients always will recover better in their home setting. And so that's exactly what the tents achieved. And I have a big hats off to our team, both the ER and our ambulatory clinics. Many clinics who had to curtail their practices because of COVID, those team members, without hesitation, jumped out of their comfortable offices and jumped into tents in the parking lot. And there were some days, we would go out there to see the wind blowing at 20, 30 miles an hour and snow driving, and they were out there still smiling and ready to serve our community, and really was grateful for all the work that they did, being willing to jump in a different environment. And as that time went on and as testing improved, and I think you have a photo or two of us getting ready for some of the testing, and we were able to get a quicker turnaround time, we found the tents to not be necessary, as the first wave didn't bring the volumes of patients that we had suspected. So it did its purpose initially to keep patients in a safe place, but then as the summer went on, we were able to decommission the tents because more knowledge was obtained about the disease. Our testing was improved. Rochester Regional spun up some of the really a large amount of local COVID testing and enabled us to get patients tested and results back at that time within 24 hours. And that was really before any real rapid testing had made it to the market.
So we're also going to, the community responded, the community and staff came together. Right now we're starting off with this chalk art that I think was over the summer.
Absolutely. So the team had been through a lot in that first wave. They worked long hours, and what we wanted to be able to do was help them channel some of their energy into showing some spirit. And so we did a chalk art competition where we asked teams from each department to come out and paint our sidewalks around the hospital with chalk with something related to how they felt about their team's response to COVID, and you can see there's some great photos there of the chalk art, and we can only capture a few, but there were many that really helped illustrate how the team was feeling about their counterparts and the work that our group had done. And that really merged into a wealth of community recognition as well. Again, we could probably spend hours here today looking at the pictures that we've been able to obtain for community, but I mean, the one notable one here is our local fire departments, EMS and law enforcement, the fire department, just letting our team know. And this photo went viral around the hospital with the team members. So grateful to see their partners who also were on the front line. They were also the people who were just as vulnerable and exposed as we are. And it just was a good reminder that we were all in it together, and we all respected and we're grateful for each job all of us did. So that was it really did help lift the spirits of the team, keep them looking forward, and keep them focused on why we're doing what we're doing, which, as you can imagine, during these stressful times, it's always good to have that.
Dan, your timing is good. I happened to just hit on the firefighters right as you mentioned them, so without even knowing what I had up. That's great. And also, you got a lot of food donations.
We did. The other part about this was as the restrictions on restaurants went into place in the wave one, those applied to the hospital as well, and we had to curtail some of the food service options we had available to the staff at the hospital and focus our efforts on making sure patients receive their meals. So with that, many of the staff had to count on bringing their food in, if they were going to have lunch or dinner. And what we found was the community stepped right up and wanted to do something for us for that. And there were so many opportunities where food trucks were donated, boxes of meals, cookies, just things, all with a grateful note from our community, thanking our team for being there. And we couldn't have been touched more by that. And really, it couldn't have come at a better time. So really grateful for our community friends out there in the restaurant business and those who sponsored that to provide the donations for us.
When it came to vaccine time, UMMC took place in the trials, I take it?
Yeah, Rochester Regional as a whole took place in the trials, and so our staff had the opportunity to participate in them and could sign up to be part of the trials. So through the spring and in the summer, many of them wanted to be on the front lines and be able to test the vaccines. That was a testament to their faith in the healthcare science and what was evolving here. And the need to make sure we could get a vaccine to the market as quickly as possible so that the patients could benefit from this. And so our health system participated fully with the vaccine trials in an effort to get them out there. And we couldn't have been happier. And it was a milestone in this journey in December. And vividly remember being on a leader meeting throughout the health system where our incident command team announced that day was the day that we were going to be providing the first doses of vaccine to our staff, which would eventually make it out to our community. And that's exactly what happened. Our physicians, our nurses, our staff stepped up, and they were able to get the vaccine and get really that moving along, building that immunity amongst the team. And today we've administered thousands and thousands of doses of vaccines to our frontline healthcare workers and partnered with our community, such as Genesee County Health Department locally, with providing vaccine to our first responders in the community and eventually to community members as the criteria has opened up more and more. Even opening a drive-through vaccine clinic, as I think we illustrate here as well, to be able to efficiently give vaccine to our patients. Winter's a tough time for that, but we did try the drive-through for a little while, but we continue to host community clinics as the vaccine is made available. But most importantly, this could not have been done without a collective effort from a health system, an integrated delivery system like Rochester Regional Health that marshaled resources on all fronts to make sure we had what we need locally to care for our community, and a community that stood by us, that had our back, and whose back we will have going forward. I can't thank our team enough. 900 dedicated people going to work every day through this, some days not knowing what information they were going to get next out of COVID, and other days knowing that what they're doing is making a difference in keeping our community healthy and getting people back to that normalcy we all look forward to. And for Genesee County Chamber of Commerce, Howard, I can't thank them enough for this recognition. It means deeper than anyone would believe to the team members, knowing that they're recognized for the hard work they did this year, and knowing that Rochester Regional Health and United Memorial Medical Center will continue to be on the front lines going forward, developing new and innovative healthcare in our community.
Well, Dan, I appreciate the opportunity to share that story with the community. I don't think we've seen it quite, it's all been bits and pieces as we've covered this. It's the first chance to really kind of look at it comprehensively, and I appreciate your team sharing the pictures too, so we can share them and talk about what that means. It really is an impressive effort by your staff.
Well, thank you, Howard. They're great people, and I call them heroes every day, and they've earned that title.
Great, thank you. Well, I appreciate your time, Dan. I don't want to take up too much of it. I know you got a hospital to run.
Thank you, Howard. Thanks for having me, and always enjoy talking with you.
It's great as always. So thank you very much.